Okay, welcome back, members. I'm going to reconvene Human Services, Finance, and Policy. So we're going to come back to order. So the first item on this part of the agenda is House File 1825. House File 1825, I'll move it so it's before the committee, and it will be laid over for possible inclusion in our Human Services Finance Bill. Welcome, Representative Edelson, to the committee. It looks like you have a DE1 amendment.
I do, Madam Chair, and I would like to move the DE1 amendment.
I'll move the DE1 amendment to get the bill in the shape before your presentation. So members, all those in favor of the DE1 amendment, please say aye.
Aye.
Any opposed? Okay, the DE1 amendment, the motion prevails and the DE1 amendment is adopted. Representative Edelson, to your bill as amended.
Thank you, Madam Chair and members. Good to see all of you. I miss being on a health committee, though I imagine you guys are very busy at this time. House File 1825. What it does is it creates a legislative task force to look at the background, to look at the eligibility and the disqualifications that we have currently in statute. The last time we really did a look at this statute for DHS background checks was in 2003. What we know, and if members referenced in their packet, there are many stories about minor infractions that maybe happen on someone's criminal history that disqualify them from being care providers or working in certain fields because of this. One story SEIU included in the letter was that of Emily, who had check fraud on her record and lost her job at a clinic. So what this does essentially is creates a task force. I have been in contact with the counties. They have a place on this task force, and it is bipartisan in the Senate. And my goal is to make it bipartisan in the House. After things slow down a little bit, I will be in contact with many members. But it is a pretty straightforward bill. It has 24 members on the membership, and I've been in contact with DHS, who also will have presence on this. And so, Madam Chair, I would go to my testifiers. I think that their stories are really imperative.
Thank you, Representative Edelson. The first testifier is Todd Gremens. Welcome to the committee. Please state your name and affiliation and then proceed with your testimony. And unmute yourself.
Absolutely. Thank you. My name is Todd Gremens. Thank you, Madam Chair, and for allowing us to be heard on this. I think it is a very personal touch, to be able to testify to actual people's testimony and how this truly affects people. This program, this kind of was derived from DHS holding on to people's background records for lengthy periods of time, especially for people that have committed nonviolent offenses. What are creative ways to truly succeed and to help our communities right now with COVID-19 drastically harming our communities? We've seen it lead over into the PCA community. For example, someone who is a PCA being blocked from licensing from something as like a drug charge. So something that was a nonviolence offense, but also has then hindered the work livelihood of many people. And as you can imagine, what a PCA worker does is take care of people who are in these like vulnerable positions without care or help. This will help alleviate some of those opportunities. As likewise, real estate, being a realtor, any type of nonviolent offense. There's things such as this that really hold people back from expanding, being able to push into their careers. Being a leader of Black Lives Matter, St. Paul, this is a real testimony as to things that we have to do that have been plaguing our community in a sense, to just at least create a task force to review these kind of things, inclusive of House committee. So as it's structured, there's 14 different positions that are cumulative of a majority and then a minority whip holder having the opportunity of both Democrat and Republican to play a part in figuring out unique ways to review this, to take a look at DHS and some of the practices that would alleviate us building a better bridge for our communities to get people in the workforce and truly help. So I just want to definitely yield my time back to giving other testifiers time, but it's very structured in a sense to be inclusive of doing more research into how we can fix things.
Thank you, Mr. Grumans. Let's see, next testifier I have is Ron Elwood from Legal Aid. Welcome, Mr. Elwood. Please proceed with your testimony.
Thank you, Madam Chair and committee members. Ron Elwood from Legal Aid, and I'm here to testify today in support of House File 1825, and I want to thank and commend Representative Edelson for authoring this bill. DHS background studies, of course, serve an important purpose in ensuring vulnerable populations, including minors and older Minnesotans, are not placed at risk by those who would be their caretakers and service providers. But workers in these fields are disproportionately low-wage workers, workers of color, and legal aid clients. And while safety, of course, of our youth and elders is paramount, at the same time, we have seen too many instances where, based on current law, would-be workers who we can show are deserving are disqualified. It is here where the task force's mission of identifying existing statutes' weaknesses, inefficiencies, unintended consequences, and areas for improvement or modernization resonates most strongly for our clients. As in all areas of the law, we always seek the proper balance of interests. As veterans of the legislative process know all too well, task forces are often a place to punt a controversial issue and where solutions potentially go to die. But other times, task forces can be the ideal venue to grapple with thorny issues with competing, though equally legitimate interests. And I firmly believe that this task force fits in that latter category. And in closing, I want to thank Representative Edelson for the DE amendment that includes Minnesota Legal Services Coalition on the task force. We have significant experience in this area and look forward to being an active and constructive contributor to the end product. And thank you very much for allowing me to testify in support of House File 1825 today.
Thank you, Mr. Elwood. Representative Edelson, we don't have, it's a blank appropriation. Do you have an idea of the estimate for the cost of this?
Sorry, I was muted. Madam Chair, I do not at this time. I don't know if fiscal staff have any. No,
I'm just wondering if you had an estimate. If not, we'll wait for the fiscal note. Thank you, Representative Edelson. Questions from members? Representative Albright.
Thank you, Madam Chair. Good morning, Representative Edelson. I'm looking at your DE amendment, and so if you could pull that up, we'll be referring to that.
I have it, Representative Albright.
Thank you. Just talking about the membership of the committee, it's very expansive. I'm wondering if you could give some detail in terms of the determination of the members that were included. I'm wondering, and I don't see it, but you can certainly point to it. I don't see any representation on this commission from law enforcement. Is that true?
Representative Edelson.
One moment. No, well, yes, actually, Madam Chair.
Representative Edelson.
Madam Chair, Representative Albright, on line 1.22, 2 members representing county attorneys and law enforcement is noted there.
Representative Albright.
Thank you, Madam Chair.
Okay, other questions from members? Not seeing any. Representative Edelson, any closing comments?
Madam Chair and members, we took the legislative task force approach, Senator Abler and I, though I know we're not supposed to mention the other body. We took this approach knowing that this is a controversial issue. There are definitely parts of the current statute that are there to protect people and that we absolutely must keep in there. But there are parts of the statute of the 245 statute that create massive barriers and that don't necessarily protect public safety. So I ask members for their support.
Thank you, Representative Edelson, and thank you to our testifiers. So House File 1825 as amended will be laid over for possible inclusion in our Finance Omnibus Bill. The next item for consideration is House File 1512. Representative Edelson, I'll move House File 1512 so it's before the committee, and it looks like you have an A1 amendment. So I'll move the A1 amendment. Want to briefly describe the amendment, please?
Yes, Madam Chair, the A1 amendment is after working with DHS to just make sure that we didn't go into other parts of statute that we weren't intending to.
Okay, members. Any questions on the A1 amendment? Seeing none, all those in favor of adopting the A1 amendment, please say aye.
Aye.
Any opposed? Okay, the motion prevails and the A1 amendment is adopted. To your bill as amended, Representative Edelson.
Thank you, Madam Chair and members. House File 1512 as amended, would remove the requirement for DHS to do a background check on persons who already require a background check in the medical field that say work at outpatient surgery centers, hospitals, and other facilities that are licensed by MDH. Doctors and nurses would be a highlight from that statute that's listed within 214.01 subdivision 2. What we have done with this bill is we've worked with MDH as well as DHS, who are all here to answer any questions members may have. But essentially right now, say a doctor that works in a hospital is required to do 2 background checks. So one for the licensing board and one for DHS, where say if that same, another physician works at a clinic, they are not required to do both, just one. And so for clarification, I'm happy to have Mary Krinke, my testifier, talk a little bit more about this. Thank you, Madam Chair.
Thank you, Representative Edelson. Ms. Krinke, welcome to the committee. Please state your name and affiliation and then proceed.
Great. Thank you, Madam Chair and members of the committee. And it's nice to be in this committee today. My name is Mary Krinke, and I'm with the Minnesota Hospital Association, and we support House File 1512. And as Representative Edelson said, what we're trying to do is really get at duplication that exists right now. If you are a licensed healthcare professional through your health professional licensing boards like the Board of Nursing or Board of Medical Practice, you have to get a background check and a fingerprint there. And then similarly, you have to get that done with DHS. And what we're trying to say is that we think it is sufficient to get that done with the licensing boards and not have to go through a secondary background check and duplicative fingerprint with DHS. So for the other healthcare workers who do not have a professional license, they still are going through the DHS process. So I want to be clear, if you work in childcare or home care and you do not have a separate health license, you are still going through the DHS process. We think that one background check and one fingerprint is sufficient. I just want to give 2 quick examples, as Representative Edelson said. So let's say you are a nurse and you are working in a clinic setting and you accept a position to go work at a hospital, all within the same health system. You're merely moving from a clinic setting to a hospital setting. You would then be required to get another background check and another fingerprint, even though you may be caring for the same individuals. We have also found, and I'd like to use this as my second example, we go to recruit a physician from out of state, and they would have to come to Minnesota. And of course, they would have to be credentialed as a physician in Minnesota. They would have to be licensed as a physician in Minnesota. They would have to get a background check and fingerprint, all with the Board of Medical Practices. But then they would also have to get that done with DHS. And so we have heard that this is a burden to these individuals to have to go through this process twice. It sometimes involves us having to fly these physicians in, putting them up in a hotel, and then literally having them get transportation to the limited fingerprinting places that are part of the DHS vendor. So we are trying to streamline this process. And also, the only other comment I want to make is, you all know right now, with the pandemic, the governor, through the executive orders, has put the fingerprinting and background check on hold. And there are now some approximately 200,000 people that may need to get a background check and fingerprint done within 60 days after the emergency powers end. And so we believe that by streamlining this process, that would at least ease some of the burden by taking some of those licensed healthcare professionals out of the DHS process. And we've been working very closely with MDH and DHS and hope that we can find something that everyone can agree to. We know of no opposition. So thank you, Madam Chair.
Thank you, Ms. Krinky. Representative Keel.
Thank you, Madam Chair. I'm wondering if either Ms. Krinky or Representative Edelson can answer this question, but we have a lot of nurses that go back and forth between North Dakota and Minnesota. Some I know are trained and licensed as they graduate from school, but would that also, what do I want to say? If they had a North Dakota license, move to Minnesota, do they have to redo all of that, or could they bring that to Minnesota as they're working back and forth? I know we looked past that when we were having COVID issues, but I'm in support of trying to make this run much smoother. I think our PCAs, some of those areas, we're going to have some real problems when we start to, as Mary Krinky said, get them up and licensed and not lose them in the process. So I certainly want people to have background checks. I or make sure that we are licensed. But anyway, maybe Mary can respond to the nursing system.
Ms. Krinky.
Madam Chair and members of the committee, while the Minnesota Hospital Association certainly supports the multi-state nurse licensure compact, this is an entire issue. You still have to be a licensed nurse in good standing. So you still have to go to the Board of Nursing. You still have to be a licensed nurse. You still have to have a background check. You still have to have a fingerprint. You just don't have to have two done, okay? So I want to be clear. We support a background check and a fingerprint. We are trying to streamline it so that individuals don't have to go through this process twice. So regretfully, Representative Keel, to your question specifically, that individual would still have to be a licensed nurse in Minnesota. Okay.
Yep.
Thank you, Ms. Krinky. Chair Liebling.
Thank you, Madam Chair. So I actually have more than one question about this, but here's the one that I'll ask. I'm looking at the language of the bill, and I know that the amendment struck one of the sections, but in the language of the bill on line 2.15, the paragraph that essentially is the meat of this, it says the commissioner is not required to conduct a background study. And then at the bottom, it says, unless the commissioner has reasonable cause to conduct a background study. Those things seem to me to be perhaps in conflict. If we're saying that the commissioner doesn't have to, that kind of would seem to give the commissioner the discretion not to. But then with this clause about has reasonable cause, it seems to limit the commissioner's discretion to have a background study if the commissioner, for whatever reason, that there's some kind of standard. In other words, it almost seems like you're saying, instead of not required to, it almost seems like you're saying the commissioner may not, unless. So could you please explain why it's written that way and what that means?
Ms. Krinky.
I would actually like to phone a friend over at DHS, but I think we were trying to make it so that it would be potentially allowable, but would not be mandated that they do it. So, Madam Chair, I think that's my response, that it's not mandated that they have to get a dual fingerprint and background check. But if the commissioner thought it would be necessary, perhaps they worded that so that they still could ask for one under certain circumstances.
Chair Liebling, would you like DHS to comment on that?
Well, I think we need that, Madam Chair. I mean, if this is something that is potentially going to go forward, and it sounds like it actually needs more work, that it may be, because from what Ms. Krinke's comments that I drew, that probably DHS isn't quite comfortable with this yet, but it would seem to me that that last clause, the unless clause, would be not really relevant to this then, but probably we need DHS to comment on it. Thank you.
Mr. Burdick, would you like to comment or have someone on your team comment on this?
Madam Chair, that would be me, Kulani Mochi with the Inspector General's office.
Thank you, Ms. Modi. Please proceed.
Thank you, Madam Chair, Chair Liebling. As I said, my name is Kulani Mochi and I serve as the Inspector General at DHS, and one of the divisions within the Office of Inspector General is our background studies area on this. And with that, in order for us to do or to have any awareness of a reasonable cause, it would have to be somehow in our system. So in order to be able to implement this, there would have to be some sort of a data sharing agreement or agreement of sharing of information between us and the boards. And so in order to make us aware of it so that we could actually initiate a reasonable cause background studies, we would have to know about it. So there will likely be systems costs and implementation costs to be able to implement this as it's written.
Thank you.
So right now, the only way that we know if there's a reasonable cause is if it's in our system, and it would trigger that, and our system is all fingerprint based.
Thank you, Ms. Modi.
Madam Chair.
Representative Edelson.
Madam Chair, DHS and MDH and the stakeholders I've been working with are continuing to work on these. I mean, this is a very complicated bill. And so we have been engaging with them. And I just spoke with DHS yesterday. We are continuing to work on this because we don't want unintended consequences. So this is we almost have clarity around it.
Thank you, Representative Edelson. Representative Albright.
Thank you, Madam Chair, and Representative Edelson, thank you for bringing this bill forward. I think one of the purposes and one of the goals of this committee should be to look anytime that there is an opportunity to reduce the complexity for our frontline workers and our professionals to deliver the care that they've been trained to provide. And in the meantime, quite honestly, save not only the entities that they serve, but themselves, the funding, the monetary costs for these licenses and these background checks. And so I certainly recognize the concern that Representative Liebling raises, but in the overall perspective, as Representative Edelson has said, this is moving forward, and DHS is working to comply and make sure that there is quote unquote peace in the valley, if you will. It's an often used, overused term, apologies. But to either the author of the bill or to Ms. Krinke, could you give me just a little more background in terms of, there are a couple of different, I know there is one for Department of Homeland Security, there's also FBI, and there's also our own Bureau of Criminal, the BCA, excuse me. What overlap is there in the various background studies that they would provide? And it certainly seems that the plurality of those is overwhelming from what I understand.
Well,
Edelson.
Thank you, Madam Chair. And thank you, Representative Albright. We have been in contact with the BCA to look at if it was possible to actually have the BCA share the background, the fingerprints that they take, and share the data that they have with DHS to stop the duplication in that way. And that gets into data sharing, privacy issues. And so we have been in contact with the BCA, but what we found out is that information to share it is going to be very complicated, and going down that path is maybe not the best. Representative Bonner, you probably know why. So with that, Mary Cranky, if you have any further information to add.
Ms. Cranky?
Madam Chair and members, I was just going to say, I believe them both to be a BCA fingerprint. I believe that both DHS and MD and the licensing boards use a BCA fingerprint.
Thank you, Ms. Cranky. Ms. Moti, could you comment on that, whether that would be in compliance with federal law if this bill was implemented?
Madam Chair, are you, can I clarify, are you asking for because these are MDH required studies, if it's going to be in comply with federal law for the MDH programs? If that's the question, that I wouldn't necessarily know. We have an agreement with MDH and doing it under their statutes. So I'm not certain. I'm assuming, and I know Representative Edelson has been in conversation with MDH regarding that. That was why we had offered the TA about removing it out of the DHS licensed programs and to not have that in there, because it will complicate with our federal requirements in our DHS licensed programs. And so that was the TA that we had provided. I can't speak for MDH, but I know Representative Edelson has been in contact and been working with them.
Representative Edelson?
Madam Chair, actually, I have Matt from MDH here, could speak to this.
I'm sorry, who do you want to speak to this, Representative Edelson?
Sorry, I'm looking for him to see if I see
Mr.
it.
Burdick?
No,
It's from DHS. Oh.
no, it's
Do we have someone from MDH on the call with us? If not, I can follow up with my question later, Representative Edelson. That's fine.
I'm happy. Yes, and I'm happy to connect you. We have been in contact with MDH, and so I apologize that I thought he was going to be joining us today.
Okay,
Madam
Representative
Chair, might I?
Yep,
Madam
Representative
Chair?
Albright.
Thank you, Madam Chair. I do see that the representative from DHS, Mr. Burdick, is on the line. I was wondering if I could ask him a pointed question about this.
Be brief.
Thank you, Madam Chair. Mr. Burdick, we often deal with boards and their background checks in concert with what the DHS might also do for their background checks. Aren't they identical in most respects?
Mr. Burdick.
Madam Chair, Representative Albright, for the record, Matt Burdick with the Department of Human Services. I can take an attempt at this, but then might defer to my colleague, Inspector General Moti, who knows much more about this. My understanding is that there are some components of the DHS background study system that are a bit more robust in terms of automatic lookbacks and interface with court records. That said, as Inspector General Moti said earlier, DHS doesn't have any sort of policy opinion on this change, since we are just doing these checks on behalf of the Department of Health. And so to the extent that that meets the requirements for the Health Department, we wouldn't have any concern with that element of it.
Thank you, Mr. Burdick. Okay, closing comments, Representative Edelson.
And Madam Chair, it was Mark Schultz from MDH that I had asked to be here. And so I can have him follow up. He did look into the funding issue and that it would not be an issue, because that was one of our concerns, is to ensure that that was not going to be an issue. I ask members, just know that we will be continuing to work on this, just for clarification, but it is a good bill, and the duplicative process really is unnecessary at this point. And I thank you for your time.
Okay, thank you, Representative Edelson, and thank you to Ms. Cranky for testifying today. With that, members, House File 1512 as amended will be laid over for possible inclusion in our Human Services Finance Bill. Thank you, Representative Edelson. Okay, next item is House File 2127. House File 2127. We're going to lay that over and take it up again tomorrow. So first it's going to be amended. There's an A21 amendment. So first I'll move House File 2127, so it's before the committee. Then I'll move the A21 amendment, which is the governor's supplemental budget. So if it's okay with members, we'll adopt that and then do the overview of the budget and supplemental budget. So all those in favor of adopting the A1 amendment, the A21 amendment, please say aye.
Aye.
Aye. Any opposed? Okay, the A21 amendment is adopted. Okay, so this, members, is the governor's budget. So we will hear an overview on each article. There are 6 articles of both the original budget and the supplemental budget. We will take testifiers, and there'll be more testifiers tomorrow. So we will just continue to take testimony tomorrow, and we will do the walkthrough by various individuals from DHS today. And I think I'll stop after each article to see if there is a clarifying question on one article. And then when we go to testifiers, if we have time, we can take questions after the testifiers have presented. So with that, I'm going to turn it over to DHS, and we have Jennifer Sommerfeld with us to go through Article 1. Ms. Sommerfeld?
Thank you, Madam Chair. Good morning, members of the committee. I'm Jennifer Sommerfeld with Children and Family Services, and I'm going to walk you through Article 1 of the bill. So sections 1 through 3 are part of the proposal that is related to 6-month reporting and prospective budgeting. And this proposal, as we've talked about previously, will more effectively support participants, particularly those who are working, and simplify administration of the program. Sections 4 through 8 of the bill are from the SNAP Employment and Training Proposal. These sections authorize DHS to administer the SNAP Employment and Training Program in alignment with federal law. Section 9 of the bill is related to 6-month reporting. It removes language prohibiting MFIP households from aligning with SNAP's 6-month reporting requirements. Section 10 is from the Community Action Formula Change Proposal. It removes the lowest tier of base funding, which is currently $25,000 per year, and the Community Action Statute, and it allows all Community Action grantees to receive a minimum of $50,000 per year in base funding. Section 11 is from the proposal related to tribal access to food shelf and emergency assistance authority. The section adds federally recognized tribal nations to the list of organizations that qualify for state food shelf funding. Sections 12 through 23 are from the 6-month reporting proposal. Section 24 is from the proposal related to tribal access to food shelf and emergency assistance authority again. This portion amends the MFIP Consolidated Fund statute to clarify that tribal nations, just like counties that are administering eligibility for MFIP, can use the MFIP Consolidated Fund for emergency assistance payments to families in crisis. Sections 25 to 28 are from the North Star Federal Compliance Proposal. These sections ensure that state statutes are in compliance with federal law by eliminating a non-compliant statutory requirement in place right now that requires DHS to automatically offset a child's monthly North Star adoption assistance payment rather than negotiating with each family to set that rate. Sections 29 to 32 make various changes to to put in place the 6-month reporting proposal. In addition, Section 32 clarifies that unemployment insurance should not be counted when determining eligibility for economic assistance if it's paid to somebody who's 18 or 19 and that person is enrolled in school at least half-time. Sections 33 to 35 are related to the 6-month reporting proposal. And Section 36 is various repealers related to the 6-month reporting and SNAP employment and training proposals. Turning to the supplemental budget amendment, starting at lines 1.2 to 16.26. These lines relate to maintaining family connections in foster care. They align foster care and adoption background studies requirements, and it's very similar to the language that you've heard previously in House File 1287. Lines 16.28 to 17.29 are from the aligning contradictions in public assistance statutes. This language addresses some construction issues that are in the underlying budget bill and make sure there's appropriate interaction with other parts of the budget. Lines 18.1 to 18.11 are for the MFIP COLA proposal. Lines 18.12 to 22.20 align public assistance statutes again, that, as said previously, is just aligning language with other proposals and clearing up some construction issues in the bill. And then a very large block, lines 22.21 to 65.27, those are all related to the maintaining family connections in foster care proposal. What they do at a high level is provide a series of policy clarifications and updates intended to ensure that local agencies and courts are focusing efforts on preventing removals of children from their homes. And when removal is necessary, that those same lead agencies and courts are focusing time and attention on engaging with the child's relatives or kin and placing the child with the child's family rather than strangers. And that, in sum, is Article 1.
Thank you, Ms. Sommerfeld. And I'll just note to members that the bill index is on our committee website, so you can follow through the various articles and sections there. Representative Albright.
Madam Chair, and I don't know if anyone else is having difficulty. When I go to the link provided by your staff for the A1 to the 2127, it actually pulls up the A1 amendment to 1512. And so I've requested that it be resent. But I'm just wondering if anyone else is having difficulty accessing the A1 amendment to the governor's budget bill.
Representative Albright, I'm just checking our website. You're referring to the email that was sent by our committee administrator?
I am, Madam Chair.
Okay, let me look.
Correct, Madam Chair. I'm having the same issue.
Okay, let me see if it's on our committee website.
And Madam Chair, as Ms. Sunderman went through the first couple of articles of the governor's budget bill, would those be reflective of before or after the adoption of the amendment?
I believe the articles she mentioned initially were in the original underlying bill, and then she mentioned the specific lines in the supplemental budget in the amendment. And the amendment is posted on our website. So I'm gonna, if you need it immediately, our state will send it out via email, but it's also, the correct one is on the committee website.
Madam Chair, I greatly appreciate if that could be resent just for the sake of time and looking between websites. I think it's important that we all have the most current information.
Will do, Representative Albright.
Thank you.
Okay, moving to the second article, Ms. Grom.
Good morning, Madam Chair, members of the committee. For the record, my name is Christy Grom and I'm with the Department of Human Services. So I will walk you through Article 2 of the bill, which deals with our community supports provisions. Sections 1, 18, 20, and 27 relate to the acuity-based customized living rates and closing the corporate foster care loophole proposal. These provisions limit new developments of customized living settings that serve 4 or fewer people on the CADI and BI waivers in a single family home. They provide an exception for the corporate foster care licensing moratorium, allowing settings to transition to that licensure if indeed it's the correct licensure for them. And they also require a legislative report. Finally, the provisions require the commissioner to establish an acuity-based rate tool input limits based on case mix for customized living and for 24-hour customized living. Sections 2, 7, 8, and 29 relate to our substance use disorder reform package. These sections remove rate add-ons for Medicaid substance use disorder services for providers who serve parents with children, culturally specific populations, people with co-occurring disorders, and people with medical complexity. This is an administrative simplification and a cost savings item. They limit outpatient SUD services to bill for only 6 hours per day or up to 30 hours per week, or if a person needs more than that, their practitioner could request a prior authorization from the department. They provide access to a rate, an increased rate, and require residential SUD treatment providers to enroll in the 1115 SUD demonstration by January 1 of 2022. And finally, they require the commissioner to evaluate opioid treatment programs, the rate structure in those programs, and make recommendations to the legislature on an unbundled revised rate structure. This is related to an OLA recommendation. Sections 3, 4, and 5 relate to the Opiate Epidemic Response Advisory Council. These provisions update the ORAC, the council, to include a voting member from each Minnesota tribal nation. They also changed the ORAC grant cycle from fiscal year to calendar year. Sections 6, 9, 13, and 14 deal with our case management redesign proposal. These sections establish a policy direction for targeted case management. They ensure federal compliance requirements are met for targeted case management. They require the commissioner to set a statewide rate methodology for subcontracted county targeted case management. and they also set caseload size limits for targeted case management. Sections 10, 11, 12, 15, 16, 17, and 26 relate to our Waiver Reimagine Phase 2 proposal. These provisions remove county-based allocations for the DD, CADI, CAC, and BI home and community-based service waivers. They require the commissioner to seek federal approval for our waiver reconfiguration from 4 waivers down to 2 waivers, as well as for the individualized budgeting methodology for the waivers. Sections 24 and 25 relate to our tribal cost-neutral housing support allocation proposal. These sections clarify that tribes are eligible for the cost-neutral transfers from the Housing Support Fund and for Housing Support Supplementary Service Rates. This is a streamlined process which counties currently have access to, but tribes do not. So we are ensuring that they do under this proposal. Section 28 relates to the self-directed workforce union contract. This section provides Medicaid rate increases to cover the wage floor and other negotiated terms that are a part of the SEIU Healthcare Collective Bargaining Agreement with the state for personal care assistance choice programs, CDCS, consumer-directed community supports, and consumer support grant programs. And then section 30 is a host of repealers. There's a repealer related to our case management redesign provisions. There's also a repealer related to the disability service grant reduction, repealing the state quality council provision, which is no longer a functioning council. There's a repealer related to the SUD rate add-ons as part of the SUD reform package. And then a repealer for county waiver allocation requirements that are part of the Waiver Reimagine package. Moving to the amendment, lines 68.8, starting on line 68.8, there's an update to the legislative report requirement for the ORAC, the Opioid Epidemic Response Advisory Council, which changes a legislative report requirement from March to December. This is adhering to a timeline that aligns with when we'll know how much funding has accumulated in the opiate fund, so we can therefore know how much funding is available to the council to make grant recommendations. Line 68.9 to 68.19. These are changes related to the SUD reform proposal that would allow the commissioner to grant an exception of up to 6 months to providers who encounter barriers in complying with the American Society of Addiction Medicine standards that are required under the 1115 demonstration waiver. And also adds an effective date that would be contingent on federal approval for that provision. Line 68.21 to 68.27 provides some clarifying language in response to concerns that we heard related to the individualized budgeting methodology under the Waiver Reimagine proposal. Just clarifying that that individualized budgets in this proposal is not intending to push people into one waiver or another, and that it's subject to a person-centered support planning process, as well as to the independent living first policies established under 256B.4905. Those were provisions that passed last session related to disability policy statements. Line 69.1 to 70.10. These are provisions in the supplemental budget that add cost reporting for personal care assistance and community first services and supports. So essentially this provision requires DHS to evaluate PCA and CFSS rates and requires agencies to submit cost reporting data such as wages, benefits, executive wages, administrative costs, etc. This provision also requires the commissioner to develop and implement a technical assistance process that supports agencies in this cost reporting process, and that focuses particularly on smaller agencies and agencies where English is a second language and agencies that serve BIPOC communities. Lines 70.11 to 70.23 also relate to the PCA cost reporting, which I mentioned previously. These provisions require a legislative report every 2 years to provide information to the legislature on the costs noted in the cost reporting process to provide the personal care assistance and community first services and support services. Line 70.24 is a tribal cost neutral allocation clarification, just removing the word county so that we can clarify that tribes also have access to this process. And then line 70.26 to 71.4, I will turn over to my colleague, Assistant Commissioner Pollack, to describe briefly.
Thank you, Ms. Graham. Mr. Pollack.
Hi, good morning, Madam Chair and committee members. So let me back up on the author's amendment. We're starting on page 66, line 17. The following sections are bill language related to the one governor's supplemental item related to nursing home resident assessments that I presented in committee already. Oh, I think you're muted, Madam Chair. Oh, okay.
I'm just talking to my son, sorry. Mr.
Okay. I want to make sure I was paying attention. And so this is the provision we presented that's in the tracking now that relates to somebody who their case mix condition changes sooner than 90 days. So the language describes requiring an assessment and then changing the billable rate to reflect their actual need for therapy or their actual need for isolation in a shorter time period. I think the only other piece that Ms. Graham wanted me to present on is, sorry, I'm just looking for the language on customized living. Oh, okay. Page 70, line 26. This is a conforming piece of language related to the assisted living licensure law. And so what we're doing here is clarifying that in order to continue to receive customized living services payments in Medicaid for waiver services, a provider has to either meet the licensure law, the new licensure law that's taking effect this summer, which is 144G, or alternatively, they can be licensed as a comprehensive home care provider under Chapter 144A, which is the MDH licensing law for home care services, or that they're providing services in a setting that is exempt from the license, clause 11 to 13. And so this is important to continue Medicaid payment for customized living services for organizations that are in assisted living or providing assisted living services.
Okay, Ms. Graham.
Thank you, Madam Chair and Mr. Pollack. Just a couple of more provisions in the amendment for my area to go over. So line 71.5 to 71.8, simply add the SEIU self-directed worker collective bargaining agreement ratification language. Line 73.17 to 74.8 relate to the IMD and MAT overpayment. So these are new provisions in the governor's supplemental budget that appropriate funding to counties and tribal nations to hold them harmless for the department overpayment errors that occurred in the past. And that is all I have for members. I'm happy to answer any questions. Thank you, Madam Chair.
Okay, any clarifying questions? Representative Albright.
Madam Chair, and I'm not sure Mr. Pollack or Mr. Graham would be pertinent to this question, but in Article 2, we're talking about rate reform from remote services. Does that relate to DWRS rates?
Ms. Graham?
Madam Chair, Representative Albright, yes, it does relate to DWRS rates.
Representative Albright?
Clarifying question then. I know in past conversations, it has been my understanding that we were trying to move towards parity between those and other rates, but it would appear from this proposal that those DWRS rates are actually being reduced. Am I correct in that assumption, or am I reading it wrong?
Ms. Graham?
Madam Chair, Representative Albright, you are correct. This would result in creating separate rate frameworks for certain services under DWRS. So for day services, pre-vocational services, unit-based services with and without programming, And essentially, these would be separate frameworks that would pay the costs that would be incurred when those services are provided remotely. It is the result of some conversations we've had with the Centers for Medicare and Medicaid Services over the past several months, which have been varied conversations. We're still seeking clarity from CMS on whether or not we need to adjust our rate frameworks for remote provision of these services. So there's still some unanswered questions as it relates to this proposal. So we continue to monitor the issue closely and work with CMS on it, as well as with providers.
Representative Albright.
Madam Chair and Ms. Grum, as you are well aware, this has been an issue of great debate over the last several biennium, and particularly with regard to the compensation and care provided to those that are the most vulnerable amongst us. So I appreciate your notation that you are undertaking ongoing conversations, as this committee will, and I look forward to hearing hopefully a positive outcome from those conversations for the benefit of those that not only provide the care, but for those that receive the care that is so desperately needed in this state for those individuals. Thank you.
Thank you, Representative Albright. And I know we have Mr. Greenman here from DHS to talk about the fiscal piece. So if members have questions about that, we can do, I think we'll go to, if Ms. Grum doesn't have a response or is finished with the walkthrough, we will go to testifiers to make sure we get all the testimony in. Ms. Grum, is that okay with you?
Madam Chair, that works
Great.
Perfectly for me. Thank you.
Thank you. So the first testifier is Bill Messenger. Welcome to the committee. Please state your name and affiliation for the record and then proceed with your testimony. And unmute yourself, please.
Here we go. You ready? Hi.
Please proceed.
Chairwoman Schultz and committee members, thank you for the opportunity to speak today. My name is Bill Messenger, and I'm affiliated with the Coalition of Recovery Investment, and we've been working for the last 7-8 years on trying to increase funding for SUD services and also improve policy. So for the past few years, we've been working on the opioid bill and the 1115 waiver, and the idea was to try to increase the amount of money that's coming into the state budget to better serve people with substance use disorders, including the population that is kind of chronic in the jail system, in the hospital system, or on the streets. And we would like to comment that we've been disappointed that the governor's budget actually cut funding for SUD services at a time when needs are increasing substantially. And we now note that there's a lot of COVID money coming in and other money available. And we think now's the time to increase funding, not cut funding. And we're particularly interested in increasing services for people who need wraparound, consistent treatment management. And that includes the RCOs, the recovery coaches. It includes the healthcare navigators, a number of improvements that we think the system needs including additional funding in order to improve services to this a group of people who are now underserved and suffering in our community. So with that, we'd like to be able to make comments in the future on increases in the budget. Now that Governor Walz apparently is opening up that issue for committee members like yourselves to focus on these unmet needs. So with that, I will thank you for granting me the time to testify, and we'll submit something further to the committee. Thank you.
Thank you, Mr. Messenger. The second testifier we have is John Magnuson of March. Welcome to the committee. Please proceed with your testimony.
Thank you, Chair Schultz and members of the committee for the privilege of testifying before you today. My name is John Magnuson, Executive Director of March, the Minnesota Association of Resources for Recovery and Chemical Health. March is a statewide professional association of addiction treatment professionals and organizations striving to raise awareness about addiction and the power of recovery. We work to improve access to quality behavioral health services for all Minnesotans who need support and share the value of long-term recovery to the individual, family, and the communities we live in. Our three overriding public policy goals this biennium are increasing access to treatment, strengthening the SUD and mental health workforce, and creating sustainability for the behavioral health continuum of care. The governor's proposed budget as presented has the very real possibility of challenging all three and destabilizing the provider base already compromised by the stress of the COVID pandemic, while we deal with historic spikes in overdoses, suicides, opioid and meth and alcohol abuse. Therefore, we oppose the governor's proposed budget for SUD as it mandates an unrealistic time frame for enrollment in the 1115 demo, proposes cuts to existing enhanced rates for co-occurring mental health, medical necessity, women and children, and culturally specific programs, and lacks the necessary transition supports, technical assistance, and grants needed to be successful in the implementation of the demo. March has continued our bipartisan consensus building approach to finding solutions with House and Senate committees, DHS, mental health colleagues, RCOs, schools, and other partners in the behavioral health continuum as we work to resolve issues and improve the opportunity for Minnesota to be successful in the 1115 demo. The March Alternative Framework of Solutions includes a more realistic time frame to onboard the 1115 demo, retains the enhanced rates until rate reform is complete, and provides technical assistance, rate adjustments, and grants to fill gaps that improve quality and expand access, fully funds and completes the necessary regulatory reforms underway. In closing, these solutions are mostly agreed upon by all parties as necessary to build an evidence-based, patient-centered, fully integrated behavioral health continuum of care for the people of Minnesota. Even better, the resources to do them exist right now due to many one-time opportunities of federal funds for SUD from the CMS 1115 demo, the SAMHSA block grants, the American Recovery Act, and the COVID-19 relief funds. Therefore, we urge the committee to please support the March Alternative Framework of Solutions and keep funds meant for SUD in service to the needs of SUD. Thanks, Chair Schultz and the committee for the opportunity to testify.
Thank you, Mr. Magnuson. The third testifier we have is Marty Paulson. Welcome to the committee. Please state your name and affiliation for the record and proceed with your testimony.
Chair Schultz and committee members, thank you for allowing me to testify today. My name is Marty Paulson, and I'm the Executive Director of Project Turnabout Centers for Addiction Recovery, headquartered in Granite Falls, Minnesota. I am also privileged to be the president of the Minnesota Alliance of Rural Addiction Treatment Providers, of which I am here representing today. In May of 2018, 9 Minnesota substance use treatment providers voluntarily worked extremely hard and long to meet the requirements of the 1115 demonstration project. 5 of those 9 providers were rural in locations and members of the Minnesota Alliance. We were told then that due to the federal funds this waiver allows, it would save the state 94% of the expenses related to substance use disorder at the time. We were also told that this project would bring 15% increase in revenue to residential programs and a 10% increase in revenue to outpatient treatment services programs. These increases would help us to cover the costs of the increase in staffing requirements that are written into the waiver. Never were we told this project would become mandatory. Never were we told all providers would be mandated to provide certain programs and/or certain medications. Never have we been told the state would be taking away the added enhancement rates we all had been receiving. This loss would range from 6% to 24% revenue, depending upon how many enhancements the provider was currently taking on. Hence, a provider could ultimately lose their revenue by 9%. Is there really parity in any of these mandates? And all of this is coming at a time when, unfortunately, over the last 12 months, COVID-19 has unintentionally created significant consequences for those in need of substance use treatment disorder. The state of Minnesota has seen a 31% increase in overdose deaths since March of 2020. Treatment centers have seen a dangerous reduction in the number of beds available and a significant shortage of staff. Loss of regular support meetings, isolation, loneliness, no structure, and a fear to reach out for help has created a perfect storm with no lifeline. If the governor's proposed budget goes through as written, we will lose revenue, we will lose treatment beds, and treatment centers will close. Quality of services will be reduced, and the people of Minnesota, still in need of help, will suffer. Now is not the time to take funds away from us. We need your support. I thank you for allowing me to testify today.
Thank you, Ms. Paulson, for your testimony. The last testifier I have is Sadie Bruckemeyer. Welcome to the committee. Please state your name and affiliation and then proceed with your testimony.
Thank you, Chairwoman Schultz and the members of the committee for allowing me time to discuss the impact that the removal of the enhanced rate will have on family treatment. My name is Sadie Bruckemeyer, and I'm the Executive Director of Recovering Hope Treatment Center in Mora, Minnesota. Recovering Hope Treatment Center is a 108-bed residential facility for substance use. We are proud to be a for-profit treatment provider in the world of nonprofits. We have a sustainable business model that's not reliant on grant funding. We provide over 87 full-time jobs with benefits, and we pay over $125,000 annually in property taxes that provides resources to our poverty-driven community. We are one of 5 family treatment providers in the state of Minnesota, and we want to make sure that our small voice is not lost in the discussion of the governor's budget. Family-based treatment is an evidence-based approach that allows for women and children, and pregnant women to seek services for substance use. The Department of Human Services acknowledges that the best approach to serving families is to keep them together. Currently, our center is able to receive funding through the enhanced modifier rates for medical modifiers to be able to better serve our pregnant women, and mental health modifier to be able to serve the mental health needs and trauma and domestic violence that a lot of our women have. And also to be able to allow for funding for the mother to come to treatment with their child, whether that child is brand new, 1 day old, well, usually 2 days, 2 days old or 5 years old. Mom is able to remain connected with their family system. I know that others have testified and advocated for more common modifiers of the medical and the mental health, the special populations. However, even though the women and children modifier is the least used, to me, it's by far the most important. To serve children, we receive $5.37 per family, not per child, to allow them to come to services with their mother. If a woman comes to our facility with more than 1 child, we still receive the same enhanced rate. This enhanced rate is to cover the cost of our fully licensed daycare, additional staff to help with parenting and children, the cost of meals, and incidentals that have come with having children on site. More toys, more activities, formula, diapers. We are already underfunded, and the Department of Services would like to take away the funding that we do have. This rate increase is disguised as a good thing and a strong increase in funding, when the reality for centers like ours, we will be taking a rate loss. The cost will not be a savings. It will be moved directly to the child protection system and the foster care system. We currently receive about $161.10 per month to have a child on site. And if we are no longer able to operate as a family treatment provider, the state of Minnesota will end up having to fund foster care services for the children we currently serve at the rate of $695 to $2,291 a month. On the 23rd, I attended a meeting with the March Committee and Department of Human Services. A member of the Department of Human Services was asked if the removal of the enhanced rate would water down substance use treatment centers. And she stated it would not. This is false information stated from those who are not directly working in the substance use facilities here in Minnesota. From a business model, it would not make sense for me to continue to serve children. We would lose all the funding we have for children on site. when we could financially serve 108 single women and be fully funded instead of 74 women and 34 unfunded children. This is not the model of care we want. Does not match our mission and value to not serve women and children. Again, we are one of 5 treatment providers in the state of Minnesota, and we are currently the largest treatment provider for families. During the pandemic, we already suffered the loss of Journey Home in St. Cloud, which was one of the largest providers that had been around for about 60 years. They shut their doors in June of 2020 due to financial concerns, leaving a gap in services for women and children. I hope that as the budget is reviewed, that you'll continue to prioritize funding for substance use treatment and not remove the enhanced rates. The decision to remove the rates will water down services and directly impact the availability of family treatment. Thank you for your time.
Thank you, Ms. Brockmeyer, for your testimony. That is the end of our list of testifiers for today, so I will open up to members. Chair Fisher may want to make a comment about the testifiers. Chair Fisher?
Thank you, Chair Schultz. I want to say thank you to the testifiers for their input that they've been providing. I do know that on the 1115 project that there's a group working between the providers and with the Department of Human Services. And I do know that there's some updates that we're supposed to be getting on that later on this evening. And the question I would have to the providers and to the department, how do we seem to be moving along? Do you folks feel comfortable that we're making good progress along the lines here?
Thank you. So let's turn over to DHS if they can first address that. And then did you have a specific testifier in mind that you wanted to ask that question to?
I was thinking that more toward Mr. Magnuson.
So Mr. Magnuson or DHS, if you want to start to address Chair Fisher's question.
I'll be happy to follow your direction and let DHS go first.
Sure. Ms. Grom?
Madam Chair, Representative Fisher, we are having conversations with March, and we've been having those conversations throughout the course of the past several months, having weekly meetings, sometimes several meetings a day with March to discuss the proposal, a lot of clarifications being made, and really listening to their concerns and wanting to make sure that at the end of the day, what this proposal amounts to is improved quality of substance use disorder treatment in the state. I think we all have that shared and collective vision. And we do continue to meet with March, and I think we are making progress in kind of where some of the barriers might be in terms of what proposal they put forward, and also where some of the opportunities are and where we could meet them a little bit closer to what they were hoping to accomplish this session.
Thank you, Ms. Grom. Mr. Magnuson.
Yes, thank you, Madam Chair, and to the department. We have been participating and we are grateful for the technical assistance that DHS has been providing. I'll restate that we've been working in a bipartisan way with all stakeholders to bring forward a set of solutions rather than a set of problems, and that we have mostly agreed upon by all parties as necessary to build an evidence-based, patient-centered, fully integrated behavioral healthcare continuum of care. March is committed to that, and we continue to work in that bipartisan spirit of collaboration. There are needs that are existing for the field to be successful in actually implementing what the governor's budget is calling for. And we are optimistic that we will find a way to make sure that those needs are covered so that providers and others can be successful in implementing that shared vision for all of us. So thank you for the opportunity. And thank you again to Chair Fisher for helping to carry those conversations on, and the others at the department.
Thank you, Mr. Magnuson, and thank you, Ms. Grom, for working with Chair Fisher on this issue, and we look forward to seeing what you can accomplish this week. Are there any other questions from members? Representative Albright?
Thank you, Madam Chair, and I'm not sure who to direct this to, but in concert with the bill itself, I'm looking to the spreadsheet, the proposal tracking spreadsheet, and I'm looking at line 156 with regard to the description says in addressing the SNAP error rate. And I'm reminded that I was informed some time ago that there is an error rate of 10% within the SNAP program. I'm wondering if someone could speak to that and what corrective measures have been taken to address that issue.
Let's see, would this be for Ms. Grom or Ms. Sommerfeld? Ms. Sommerfeld?
Madam Chair, Representative Albright, I'm going to defer to Tiki Brown, who's our SNAP manager.
Ms. Brown?
Good afternoon. For the record, Tiki Brown with the Minnesota Department of Human Services. To your question, yes, we in SNAP do have a high error rate, one that has been increasing over time. At this point in time, we are on a process with USDA to take corrective actions, such as meeting with the counties and tribes that have a high error rate, working with them to put in place some mitigation efforts. And also the department has assigned a staff person to work on a payment accuracy effort to help mitigate and hone in on the top errors that we do have at this time.
Thank you, Ms. Brown. Representative Albright?
Thank you, Madam Chair. Ms. Brown, you mentioned that it's been increasing over time. Could you elaborate in terms of how long this issue has plagued the department?
Ms. Brown?
Thank you, Madam Chair and members. This error rate, I don't have the exact time frame, but this isn't a method that we work with the U.S. Department of Agriculture and review over every single year. And certainly over the past several years, we have seen that error rate creep up. And there are a number of reasons for that. Some are which are explained in our proposal that we would like to mitigate, working on our technology systems, providing more technical assistance to our counties and tribes. But it is a rate that, due to some of the complexity of our systems and some of the extra steps that our counties and tribes must take, this does increase our error rate over time.
Representative Albright?
Thank you, Madam Chair. And Ms. Brown, I appreciate the response. Because this is a federal program as well, coordinated with our state agencies, it's eerily reminiscent of, and I'm not trying to throw out any pejoratives here, to the error that we certainly are trying to address with regard to the antagonist for opiate addiction on some of those issues on the federal level. Is the federal Department of Agriculture looking for clawback on some of these overpayments, or what really is the issue here? And are we looking at a federal, demand for repayment of those overpayments? Could you give me a little more elaboration? I really appreciate your assistance in this matter.
Ms. Brown?
Certainly, Madam Chair and Representative Albright. We are currently in first year liability status, which means we have been put on notice by the Department of Agriculture that unless we improve our rate, we in fact will be granted a sanction. That sanction is a formula that USDA does put in place, and we don't know the exact amount that we would be sanctioned until we are in that situation. I will say, because of the pandemic, we have been granted a reprieve, all states in the nation, due to just the unusual nature of the pandemic, and so no sanction has been put in place for this year. We are at risk for sanction during the next time frame.
Thank you, Representative Albright.
Thank you, Madam Chair. Ms. Brown, has the Department of Agriculture informed you of what an acceptable range of error would be to be alleviated or be removed from that sanction status?
Ms. Brown?
Madam Chair and Representative, yes, although that rate does change from year to year, the U.S. Department of Agriculture takes in account all of the states across the nation, the error rate, and they put together an average. It's expected to be in the 6% range, although it does vary from year to year.
Representative Albright.
Madam Chair and Ms. Brown, under the provisions of that line item in the proposal tracking, is that intended to just recover the excess, or are we really trying to get at what is wrong with the system and take corrective actions? I know one issue is to kind of just glossed it over, but I appreciate your tenacity in trying to correct it. Obviously, we don't want to have sanctions imposed upon us, but how long do we have in order to remedy this situation before Washington would take further actions toward your agency?
Ms. Brown?
Thank you, Madam Chair. So the time frame is a little bit convoluted. We do get notified each June of our potential error rate, and upon which USDA would notify us if we were in sanction status or not. Again, because of the pandemic, we won't be notified this June, but rather June of 2022. So we have a period of time to make those corrections. And the proposals that we have put forth in this proposal are based on conversations we've had with counties and tribes, things that would make their work easier, so that would mitigate some of the errors, as well as increase our capacity at the state level to provide the technical assistance that they have requested.
Thank you, Ms. Brown. Representative Rasmussen.
Thank you, Madam Chair. I'll seek your advice, Madam Chair, as to who would be best to direct my question to, but I know we're getting more numbers on the American Rescue Plan and the $8 billion that the state of Minnesota will be receiving. And it's my understanding from reviewing some information that has been put out by MMB that there's quite a bit of dollars that are focused in on the work of this committee in terms of human services. Just a couple examples, there's a mental health block grant, substance abuse block grant, that would touch on some of the items that we've talked about today. And so, Madam Chair, I was wondering if perhaps there was someone from DHS, perhaps Mr. Burdick, who could comment on how DHS and the governor is thinking about leveraging those funds that are available to potentially fund, the governor's budget priorities that have been presented here today.
Thank you, Representative Rasmussen. It does sound like a lot of money, $8 billion, but a lot of that money, remember, is going to our local and county units of government. We have about $2.6 billion coming to the state. That's somewhat unrestricted, but a lot of it also is in HHS through grants that is very restricted. So we're still learning about all of those funding opportunities for the state, especially in health and human services. And I believe either Mr. Burdick or Mr. Greenman can probably help address that. Mr. Greenman?
Excuse me, Madam Chair, Dave Greenman, Budget Director with the Department of Human Services. Thank you for the question. The state has received about, of the $8 billion, I think we can sort of put it into the amount that is in front of that the Department of Human Services is dealing with is a portion of the $2.6 billion in federal recovery funds that go to the state would potentially go to services and programs administered by DHS. I mean, these are more flexible dollars that can be used to address COVID. And then there, as Representative Rasmussen mentioned, there's a variety of programmatic grants that go directly to DHS for specific purposes. That's a total of about $640 million that went to DHS, and we will be we're looking right now at, are there opportunities to leverage some of that funding to help with addressing the governor's budget, and also to, as we're going through the planning process, looking at how those dollars can support and enhance the work we're currently doing with the governor's budget as a partner in that. And we'll be doing outreach as we do this planning, and certainly looking for input from legislators on how we would want to spend those dollars. But at this point, we don't have a lot of information yet. It passed less than 2 weeks ago, so we're still waiting to hear from the federal government sort of what kind of limitations there are on how we can spend the money.
Thank you, Mr. Greenman. Representative Rasmussen.
Thank you, Madam Chair, and thank you, Mr. Greenman. I appreciate that and understand that a lot of the guidance, from the federal government is still being written and issued as to how these funds, can be utilized. So I appreciate the complexity and the move, how quick moving this is. I would appreciate if DHS would, keep us up to date with, how these dollars can potentially be used, because I think we do have an opportunity to, leverage these dollars to meet, some of our shared priorities. And then the last comment I would make is, I would just really implore the governor to work through the legislative process when it comes to deciding how these dollars are going to be spent. I think Chair Schultz and members of this committee have done a lot of thoughtful work, a lot of research. Chair Fisher and his group, and I would have a strong preference as a member of the legislature to see these dollars actually go through our legislative process to be distributed, because I just think there's a lot of expertise and time and perspectives that are tapped going through the legislative process. And so that would just be something I'd leave DHS with, and also the leadership of this committee. But thank you very much for the thorough presentation of the governor's budget priorities today.
Thank you, Representative Rasmussen. And I'll just remind members and people of Minnesota who are watching that I encourage them to go stream the Ways and Means Committee hearing from Monday, where we got a walkthrough from MMB about the federal money and where it would be going and where it's earmarked for the schools, for mental health, for behavioral health, for substance abuse treatment. It's very enlightening to see a lot of that money is designated for significant important for childcare, but also for state and local units, and then some for HHS. Okay, any other questions from members? Representative Albright.
Thank you, Madam Chair. Just in preparation for tomorrow, wondering what the schedule will be with regard to reviewing the governor's proposal. There is a spreadsheet, and certainly because of our financial authority over this, I'm just wondering what depth we'll take into that, as well as any remaining bills that might be heard tomorrow going into the final deadline. So appreciate your comments on those.
Thank you, Representative Albright. So tomorrow we're going to continue taking public testimony on the governor's budget and supplemental budget. We can have Mr. Greenman with us to walk through the fiscal notes or the financial aspect of the governor's budget and supplemental budget, although we did have an overview last week on that as well. We can take members' questions on that fiscal component. We are not hearing other bills besides the governor's budget and supplemental budget on Thursday. On Friday, we will convene at 10:30 a.m. And so far we have 4 bills on the agenda for Friday, so we can make deadline. So I think that should answer your question, Representative Albright, but just keep checking your email if things change, and we will send notices via email. Any other questions?
Madam Chair, if I might.
Go ahead, Representative Albright.
Thank you, Madam Chair. I referenced a spreadsheet that I'm not sure if your committee staff shared with the rest of the members. I'm wondering if that could be resent, just to put it at the top of the stack for people as we go through the financials tomorrow. I think it's imperative that we discern, as Representative Jordan, I think, really eloquently laid out the import of where these monies are coming from, whether they're coming from general fund, from cancellations from other programs, or from the Repair America Act. I'm probably not using that correctly, but just so that we are mindful and being diligent about our responsibility to be good stewards. Thank you.
Thank you, Representative Albright. We will send that out from Doug Berg, I believe it came from. If you're referring to a different one, just shoot me an email. But we will do that on tomorrow, so members have that at the top of their inbox. I'm not seeing any other questions from members, so we will convene tomorrow at 10:30, our normal time, and then on Friday again at 10:30. So with that, members, thank you for being with us all morning. We appreciate your time, and I look forward to seeing everyone tomorrow. And with that, we are adjourned.